Stomach ulcers are a common health concern. They are painful sores that develop in the lining of the stomach. These ulcers occur when the protective mucus layer that lines the stomach is weakened. This allows digestive acids to irritate the stomach lining. Several factors can contribute to the development of stomach ulcers. The most common culprit is a bacterium called Helicobacter pylori, or H. pylori. Other factors include the prolonged use of non-steroidal anti-inflammatory drugs like ibuprofen or aspirin. Smoking, excessive alcohol consumption, and stress can also increase your risk. Symptoms of stomach ulcers can vary from person to person. Some individuals may experience a burning pain in the abdomen, often described as a gnawing or hunger-like feeling. This pain may worsen at night or on an empty stomach. Other common symptoms include indigestion, nausea, vomiting, and a feeling of fullness or bloating after meals. Understanding the causes and symptoms of stomach ulcers is crucial for seeking timely and appropriate treatment. Effective treatments are available, ranging from medications that target acid production to lifestyle modifications that support healing and prevent recurrence. Medications play a vital role in treating stomach ulcers. They work by reducing stomach acid production, creating an environment conducive to healing. There are several types of medications commonly prescribed for stomach ulcers, each with its own mechanism of action. Proton pump inhibitors, or PPIs, are potent drugs that block the production of stomach acid. H2 receptor antagonists, another class of medications, work by reducing the amount of acid produced by the stomach. Antibiotics are often prescribed alongside other medications to eradicate H. pylori infection, a major cause of stomach ulcers. The specific medications and treatment duration will vary depending on the underlying cause of the ulcer and the individual's medical history. It is essential to take medications as prescribed by a healthcare professional and to complete the full course of treatment, even if symptoms improve. This will help to ensure the eradication of H. pylori infection and prevent the ulcer from recurring. Proton pump inhibitors, or PPIs, are highly effective medications that provide rapid relief from stomach ulcer symptoms. They work by blocking the action of proton pumps, which are responsible for the final step in stomach acid production. By inhibiting these pumps, PPIs significantly reduce the amount of acid in the stomach, allowing the ulcer to heal. Some common examples of PPIs include omeprazole, known as Prilosec, lansoprazole, known as Prevacid, and esomeprazole, known as Nexium. PPIs are typically taken once or twice a day, depending on the dosage and the individual's condition. They are generally safe for short-term use, but long-term use has been associated with certain risks, such as an increased risk of bone fractures and vitamin B12 deficiency. It's crucial to discuss the potential benefits and risks of PPI use with a healthcare professional to determine the appropriate treatment duration and monitor for any potential side effects. H2 receptor antagonists are another class of medications used to treat stomach ulcers. They work by blocking the action of histamine, a chemical that stimulates acid production in the stomach. By reducing histamine's effects, H2 receptor antagonists lower the amount of acid secreted into the stomach, promoting ulcer healing. Examples of H2 receptor antagonists include cimetidine, known as Tagamet, ranitidine, known as Zantac, and famotidine, known as Pepcid. H2 receptor antagonists are available over the counter and by prescription. They are typically taken once or twice a day, depending on the specific medication and dosage. While generally safe, H2 receptor antagonists can cause side effects such as headache, dizziness, and diarrhea. As with any medication, it's essential to consult with a healthcare professional before taking H2 receptor antagonists to ensure they are appropriate for your individual needs. When Helicobacter pylori, or H. pylori, infection is the underlying cause of stomach ulcers, antibiotics are a crucial part of treatment. H. pylori is a bacterium that can survive in the harsh acidic environment of the stomach. It weakens the stomach's protective lining, making it susceptible to damage from digestive acids. Antibiotics work by killing the H. pylori bacteria, allowing the ulcer to heal and reducing the risk of recurrence. Doctors typically prescribe a combination of 2 or more antibiotics to effectively eradicate H. pylori. Commonly used antibiotics include amoxicillin, clarithromycin, metronidazole, and tetracycline. It is essential to take the full course of antibiotics as prescribed, even if symptoms improve. Failure to complete the treatment regimen can lead to antibiotic resistance and increase the likelihood of the ulcer returning. In addition to medications, lifestyle changes play a significant role in healing stomach ulcers and preventing their recurrence. Making healthy choices can create a more conducive environment for the stomach to repair itself. One crucial lifestyle change is to quit smoking. Smoking weakens the stomach's natural defenses and increases the risk of ulcers developing and recurring. Another important change is to moderate alcohol consumption. Alcohol irritates the stomach lining and can delay the healing process. Limiting or avoiding alcohol is best for ulcer management. Stress management is also crucial for ulcer healing. Stress can increase stomach acid production, exacerbating ulcer symptoms. Engaging in stress-reducing activities like exercise, yoga, or meditation can promote relaxation and support healing. Dietary modifications can significantly impact stomach ulcer healing. Certain foods can irritate the stomach lining, while others can help soothe it and promote healing. Spicy foods, acidic foods like citrus fruits and tomatoes, and fatty foods can aggravate ulcer symptoms and should be avoided or limited. Instead, focus on consuming a bland diet that is easy to digest and gentle on the stomach. This includes foods such as bananas, rice, applesauce, toast, oatmeal, lean protein, and cooked vegetables. These foods are less likely to irritate the stomach lining and can help reduce inflammation. It is also essential to stay hydrated by drinking plenty of water throughout the day. Water helps to dilute stomach acid and supports the body's natural healing processes. Stress is increasingly recognized as a contributing factor to stomach ulcers. While stress itself does not directly cause ulcers, it can exacerbate symptoms and delay healing. When we experience stress, our bodies release hormones like cortisol, which can increase stomach acid production. This excess acid can irritate existing ulcers and make them more painful. Finding healthy ways to manage stress is essential for ulcer healing. Exercise, yoga, meditation, deep breathing techniques, and spending time in nature are all effective stress-reducing activities. It's also important to prioritize sleep. When we don't get enough sleep, our bodies produce more cortisol, which can contribute to ulcer formation and hinder healing. Aim for 7 to 8 hours of quality sleep each night. Seeking medical attention and adhering to follow-up appointments is crucial for the effective treatment of stomach ulcers. While lifestyle changes and over-the-counter medications can help manage symptoms, it's essential to have a healthcare professional diagnose and monitor the condition. During the initial consultation, the doctor will take a detailed medical history, perform a physical exam, and may recommend further tests to confirm the diagnosis and determine the underlying cause of the ulcer. These tests may include an endoscopy, a procedure that allows the doctor to visualize the stomach lining, or a breath test to check for H. pylori infection. Once a diagnosis is made, the doctor will recommend a personalized treatment plan, which may involve medications, lifestyle modifications, or a combination of both. Following up with the doctor as scheduled is crucial to monitor treatment progress, adjust medications if needed, and address any concerns or side effects. If you found this video informative, please like, subscribe, and share.